Good afternoon, everyone. I'm Jayatri Das, Chief Bioscientist here at the Franklin Institute. And thank you for joining me again for another conversation about the science and the societal impacts that we're looking at around the current COVID-19 pandemic. The conversation that we're having today is one that I've been really looking forward to. As many of you know, June is Pride Month. It's a time to celebrate the impact of the LGBTQ community and a time for all of us to work to promote justice and opportunity for those who have been marginalized. And in science and medicine, these efforts are especially important right now because LGBTQ people have been hit disproportionately hard by this pandemic. In some of our past conversations, we've talked about what we call these social determinants of health, about how aspects of the world that we live in and the spaces and the places where we live and work and play have direct impacts on our health. And so just to share some of that context, I wanted to tell you some data from the CDC as well as the University of Chicago, where we know that folks in the LGBTQ community work in industries that have been more highly affected by the pandemic, that put them at greater risk. They're more likely to live in poverty. They're more likely to lack health insurance and access to care, as well as societal discrimination. And so all of these have direct impacts on health. In addition, older adults tend to be more on their own with less of a safety net from friends and family, while youth are more likely to rely on schools and support organizations that are facing additional challenges in this economic crisis. And within the context of some of the issues of systemic racism that we've been talking about over the last few weeks, all of these issues are then compounded for people of color. So we did get some good news today that job protections for LGBTQ people were upheld by the Supreme Court. But we have to remember that there are major gaps in protections in many other facets of life, including healthcare. But the good news is that COVID-19 is inspiring innovations that can make healthcare more inclusive and equitable for everyone. So this week, as we have the opportunity to highlight the work of some of the Franklin Institute's incredible partners in the LGBTQ STEM community in Philly, I'm honored to speak with Marion Leary, who's leading a global effort to bring the voices of nurses to the front. Marion's the Director of Innovation at the University of Pennsylvania School of Nursing. She's a founding member of the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, and she serves on the innovation committees of multiple professional organizations. And so I'm really excited to talk to you, Marion, about what that means and how this new approach is bringing people together to tackle these new challenges. So I want to start with a really cool project that we were just discussing, feels like it happened a lifetime ago, but happened last month. You helped organize a virtual hackathon around nursing and healthcare for COVID-19. Can you tell us about what motivated this effort and what some of the critical challenges that you hope to tackle?
Sure. First, I just want to thank you for inviting me to come speak with you today. I'm a big fan of yours. I'm a big fan of the Franklin Institute, and I'm so happy for the news that the LGBTQ community got today. So much needed and good news in a few months that have not been full of much good news. So thank you for having me. I'm really looking forward to this conversation also.
And I'll just do my fan service right back at you.
So we're talking about the Nurse Hack for Health. And so as was mentioned, I am a founding member and on the board of directors of an organization called SUNCL, which is the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. And my colleague, Rebecca Love, who is a nurse and founder of SUNCL, reached out to me when the pandemic started and asked if I would help lead this virtual nurse hackathon. SUNCL has done a number of nurse-led hackathons prior to the pandemic, and we always found that it was such a great way not only to inspire nurses as the innovators they are in health and healthcare, but to really get much needed solutions out to the frontline providers. And so the COVID-19 pandemic really highlighted this need for quick, innovative solutions right when they were needed. And so we reached out to Johnson & Johnson, Microsoft, and an organization called DevUp to see if they would be interested in working with us as well. I personally did not want to do a hackathon just for a hackathon's sake. I really wanted to make sure the work that we were doing over that time period was going to benefit the clinicians on the front lines who were dealing with COVID when they needed it, not a year or 2 years or 3 years from now. And so that's where Microsoft came in and was really important too. So we decided that this virtual hackathon would be tech focused. So for those who might not know what a hackathon is, it is a weekend-long event where you bring not only healthcare providers, nurses, physicians, pharmacists, respiratory therapists, whomever, together, but you match them with engineers, designers, programmers, anybody who can bring knowledge to the problem that you're trying to solve for. And over the course of the weekend, you create the solution to the problem that was identified. And hopefully, our hope for this was that we would have a working, minimally viable product by the end of the weekend so that we could rapidly implement it and get it out to the folks who need it. This Nurse Hack for Health hackathon was open source, and so everything that was created that weekend went out on GitHub so that anyone could then pick up the solution to the problem that was being solved for and iterate it and implement it at their health or healthcare system.
So Marion, you touched on something that I found really encouraging from the perspective of how science is stepping up to the challenge of COVID-19, which is this idea of collaboration between different fields of science. And I think what this effort that you described really hits how that can work at its best when you're bringing the people who are on the front lines together with all of these people with other skill sets that can then support their needs.
Yeah, I hear this all the time. Nurses are incredible innovators. They have ideas about how to fix the healthcare system all the time. I mean, it makes sense. They're the ones, the vast majority of the time, working and seeing these problems. They just don't have the fundamental skills or knowledge on how to take that to the next level. And so, Penn Nursing and other organizations are doing a fundamental around educating nurses as innovators, but you also need other disciplines who know how to program, who know about engineering, who know about design to work with us to get these solutions out. I say it all the time. Similar to healthcare, innovation is a team sport, and you have to have this interdisciplinary, multidisciplinary collaboration to get the solutions out in a way that are functional, usable, and quickly. And so it really does take everybody's knowledge and experience to make that happen.
Yeah, so we keep coming back to this need for speed in responding to this crisis. Can you talk about some of the specific challenges around the pandemic that were assigned to the participants to tackle?
Sure. So I'll say we had a tremendous response to this hackathon, and we were able to come up with the idea and implement it. I think it was in like 3 weeks. I mean,
Wow.
really, really quickly. And we ended up having almost 1,000 total participants, 500 of whom were actively engaged on 32 teams, literally from around the globe. We had folks from Australia, India, Germany, Canada, Israel, and many, many other places, which is why, a virtual, we can go into this or not, but a virtual hackathon, there's plus and minuses to
Sure.
in-person versus virtual. And I will say the big plus to doing this virtually was that we could engage people across time zones, across countries and continents to be able to work together. And I'm a huge fan of bringing that diverse knowledge from every single sector of the world together to be able to create innovative solutions. And so it was really helpful to be able to have that much diversity in those who participated. So to get to your question though, we had 5 challenge areas that we wanted teams to focus on. And so it was remote patient monitoring in the acute care setting, so in the hospital, remote monitoring in the home setting, patient transfer handoffs and huddles was another section, data and reporting, and then resilience and self-care. And so from those 5 areas, we picked 5 winning teams. Again, there were 32 different teams sort of spread out almost evenly in those 5 areas. And the 5 winning teams really ran the gamut in terms of what they were trying to solve a solution for. And so do you want me to go into all 5 of these?
Yeah, but I was going to ask you to pause for a minute before you go into them,
Okay.
because I want to break down for those of us who might not be as familiar with this world, to talk about what some of those categories mean. I think the remote monitoring makes sense both within the healthcare setting as well as at home. Can you talk a little bit more about the patient transfer and handoff and what that means and what the challenges are there?
Sure. And so to put this in context of COVID, right? So as a healthcare provider, especially in the beginning, and still so now, but especially in the beginning of this pandemic, there was a lot of questions about how it was being transferred or, exposure, and was there enough personal protective equipment? Should you be wearing the N95 mask, surgical mask, gloves, gowns, all that stuff? And so in terms of patient transfer, handoff, and huddle, we really wanted teams to look at how you could decrease exposure so that, for one situation, you could decrease the need to continually gown up and gown off and don, personal protective equipment, and trying to make it less risky, but also saving critically needed PPE as well. And so that sort of all fell under that patient transfer, handoff, and huddle. How to do that in a way that risked less exposure.
Right. No, that absolutely makes sense, because we obviously know that there's a dose response aspect to your exposure as well. So how do you balance
Exactly.
those aspects?
Right.
Can you tell me a little bit more about the resiliency and self-care as well?
Yeah, that really mostly was focusing on the healthcare providers. One, as I'll talk about, the team that won in resiliency and self-care was looking at nurses who were dealing with burnout, stress, and sort of compassion fatigue, which is always a problem for healthcare providers, but was just amplified by COVID-19. And so really thinking about the resiliency and self-care of providers who are working enormously challenging situations during COVID-19.
Right. Okay. So it's really thinking about the holistic perspective from the patients to the process, to the providers as well. Do we still have you, Marion? Yes, you were frozen for a second, yes. But you're back.
I figured we'd come back.
Okay, so I'd love to hear a little bit more about some of the ideas that rose to the top.
Sure. So, like I said, there was one. We had a winner and then a runner-up. I'll just talk about the winning team. So, for the remote patient monitoring in the home setting, the team was called Project Flourish, and they were really looking at making telehealth accessible to people in low resource constrained areas or with low digital literacy. And I thought this was really interesting. They were using a technology that I know nothing about. So what I'm going to tell you is about the depth of my knowledge. But it was using something called USSD applications, which are technology in old candy bar phones, or those like small, think back to like 10, 20 years with the cell phones.
Right.
So it was a technology in those phones. And the idea is that technology does not require internet access. And so you could potentially start doing remote patient monitoring using telehealth with that technology. And so that was the project that they are now working on. And I'll say that all of the winning teams are getting mentorship for the next 3 months from SunCL. They're getting mentorship from Microsoft. They're getting access to a number of programs from Johnson & Johnson, all so that we can help them now move those ideas out of the ideation. And some of them had minimal viable product solutions to like larger scale. And so we really do, again, want to see these projects getting out to the providers who need them.
That's really exciting.
So yeah, so that was the home setting. And then I mentioned Well Nurse, so they fell into the resiliency and self-care bucket. And they really wanted to help nurses, again, with compassion fatigue and burnout. And they created a application for nurses to cope with stress by providing wellness tools, resources, social connections, all on a smartphone application. In the patient transfer handoff and huddle section, it's a program called Nurse GPS. I really like this one. It just, again, a smart way to, again, just be resourceful. So in the hospital setting, if you're having a new patient come in on, say, a COVID floor, there's a lot of equipment you need that could potentially be spread out around the unit. And so this is basically GPS tracking and then mapping where all of the equipment is on the floor so that the nurses don't have to keep going in and out of rooms, again, wasting personal protective equipment, potentially increasing exposure, so that they know where it is and can plan for when the patient's coming or when other patients are out of the room to pull equipment. So it was really interesting. They had a nice little video they created showing how the app worked and how it mapped the unit. Is really cool. Nurses and obviously designers, engineers, they're all so creative, and it was a really nice weekend of seeing how all these teams got from the problem all the way to the solution.
So on the, so we have a question from somebody who says that they'd love to participate in future hackathons. Will there be a next one, and what's the best way to get involved?
Yes, there will be. We need a little break. We are, I don't even know if this is official yet, but we are planning on at least one virtual hackathon a year, and when we can, another in-person hackathon. So there will definitely be at least 2 upcoming hackathons in the next year or so. And if you're interested, you can go to the SunSiel website. It's sonsiel.org, and you could either sign up for our newsletter or look on upcoming events. We don't have any dates planned yet, but we are going to start planning those.
Great. So one aspect of the hackathon that I thought was really interesting was how, and this extends, I think, in your work even beyond just the hackathon, is this idea of applying design thinking to innovation in nursing. Mm-hmm. And a lot of times, especially in science and engineering, when you think about design thinking, we get into that, iterative process of, coming up with an idea and prototyping and testing and doing that in cycles. But you really emphasize the first step in that process is empathy. Mm-hmm. Can you talk a little bit about the role of empathy in this process and how that kind of works its way into the types of innovations you think about?
Sure. So yeah, I mean, empathy is the foundation. So design thinking is a human-centered approach. And so I always like to say, especially for healthcare, a patient-centered approach is good, but a human-centered approach is so much better. People are patients for a very short period of time, but they are human the whole rest of the time, right? And so to be able to accurately design a solution for a problem, you really need to understand the entire context that this person is living in. And so empathy really allows you to do that. It allows you to go out and observe and interview and put yourself in the place of the people you're designing for. And really, it's about allowing them to show us and tell us what the problem is. It's not for us as healthcare providers or designers to go out into a community and tell them what we think their problem is and what we think their solution is. To do human-centered design correctly, you really should be co-collaborating with the people the problem affects and understanding it from their point of view. And that's really where this empathy phase comes into play. It sets the context for everything else you're going to be doing. And empathy, just like all the other phases of design thinking, it's not like one and done. It's not a straight process. You're constantly going back and to the empathy phase as you proceed through all the other phases to make sure, again, if you're not co-collaborating with the stakeholder, that you're going back to them constantly to make sure you're understanding what it is they said and what it is you saw in the context of their world.
Yeah, I think that's a really powerful lens to approach, technology development from. And it's really, thinking about the examples that you gave earlier in terms of like leveraging older technologies, as we face a digital divide in the world, that how can we make sure that these solutions are accessible to the most people?
Yeah. And I just want to, because I can, give a shout out. So at Penn Nursing, we created a free online open access platform called Design Thinking for Health, which was created for nurses to learn about nursing innovation and the phases of design thinking. So anybody can go on there, and we created original content video, lecture videos, case studies, all highlighting the design thinking process and how you can use it in health and healthcare. So I highly encourage everybody to check it out because it's there, it's free, and we want people to use it.
That's a great resource, Marion. Thank you for sharing that. I wanted to come to another use of technology that you've really marshaled in the last couple of weeks. Thinking about how you combine the idea of mutual aid with social media. And I think mutual aid is this idea of communities supporting each other that has come to the forefront in lots of different ways during a pandemic, as we're all trying to figure out how to help people who need help in a time where we're all isolated. And you helped organize a Twitter conference that you called the Nurse Mutual Aid Conference. And can you talk a little bit about the goals of that conference and why mutual aid felt like the right context to frame that in?
Sure. So I will say that this all started where most things in my life start these days, on Twitter. So a colleague of mine, Dr. Rachel Walker from UMass Amherst, put out on Twitter when this COVID-19 pandemic started that she was noticing that in-person conferences were being canceled left and right. And for students, nursing, faculty, scholars, all scholars really, nursing conferences are really important. And so she just happened to put out on Twitter, wouldn't it be great if we could do a Twitter conference for all these folks whose conferences were being canceled? And so a number of us were like, heck yeah, let's do it. Let's put on a Twitter conference so that we could give a platform to people whose conferences were canceled. As we started talking about it, though, we realized that there was a lot more going on because of the pandemic than just canceled conferences, and that we really wanted to transition it we wanted to make it a bigger thing than just a Twitter conference. We wanted to create a platform where we could put out resources and exchange of ideas and services for nursing students, faculty, communities, etc., who may have been disproportionately impacted by the pandemic. Folks who were already marginalized, but then now it was just like doubly hit because of the pandemic. And so we transitioned that virtual conference to more of a co-created digital platform where we have resources around nursing mutual aid. But we also still then did do the Twitter conference, and I can talk a little bit more about that.
If folks are interested in checking in on what the discussions were about, is there a hashtag for the conference that people can look up?
Totally. And actually, the hashtag was NMA, Nursing Mutual Aid, so NMA 2020. But we also put together a transcript of all of the tweets. So it's an archive of the entire conference, which is on our website, which is nursingmutualaid.squarespace.com. And on there, there's what's called a Walklet. That's the online platform where you can archive all of your hashtags. And we did that for our conference. So you can go back and go through all of the Twitter conference.
That's really great. And I think, what I really admire about these efforts is, is your innovative use of, the virtual community that exists online to think about how nurses can come together to serve the broader community.
Totally. So the great thing about doing this conference on Twitter, especially, was that, first off, you should know that most of us who were the organizers had never met in real life before. We only know each other and only friends and colleagues from Twitter. I mean, now, we Zoom all the time with each other, which I guess we still haven't met in real life. But, most of us only knew each other from Twitter. And so Twitter is a great platform because we were able to have it be open access. It's free. It's accessible in other languages. Presenters from various time zones could also participate. People could easily follow along using the hashtag. And again, we were able to archive all of the tweets. So it was a really great platform, an inclusive platform that we were able to then use because of everything else that was going on. And just similar to the virtual hackathon, it really allowed people to participate who may otherwise not have been able to.
Right.
Which we really appreciate.
And I think the other piece of that is that this is a publicly accessible conversation. And I want to circle back to something that you talked about, you touched on a little bit earlier, this idea that nurses are in a unique position to serve as a bridge between the public and the patient community and the medical community. And you've really championed the voice of nurses in that role as science communicators. Do you have any particular experiences, whether it's COVID-19 or more broadly, where nurses can bring a different perspective to this conversation about science?
Always. I mean, any and all. So nurses work, yes, we were at the bedside, but we were in so many other places. We're in the research labs, we're out in the community, we're in schools, we're in startups, we're in the military, we're in Congress, we're in all these places and so much more. And it really gives us the breadth, depth, and experience unparalleled. I really feel like we are the keystone for health and healthcare. And so we are the exact right person to be communicating science to the public. So nursing, once again, for the 18th consecutive year, was voted as the most trusted profession in the country. The World Health Organization has designated 2020 the year of the nurse and midwife. First time they've ever designated a year for a profession. Like, all of these things are the reason why nurses, A, should be out communicating science, and B, are a trusted source for science communication. There are so many nurse experts in all these different domains, and it's just about the media, journalists, recognizing them as experts, recognizing us as the experts that we are. And it's also for nurses to use their voice in a way to also help translate and transmit that information out.
Yeah, absolutely. And I think oftentimes when you're in the healthcare setting, that the nurse is your primary point of contact, your primary caregiver, and there's that personal level of contact that you might not have with others who are kind of coming in and out at different levels. And so we know in any kind of a science communication space, it's that trust that really founds that bedrock.
Totally. And I think, nurses, especially with Twitter now, we're starting to see more nurses stepping up and using their voices in that way. It's definitely not something that has been taught in the past in nursing school, but I just recorded a lecture for our nursing students for one of their classes at Penn Nursing. So it's starting to slowly get put into the curriculum as well, because nurses need to be out there just like physicians. It's not a either or. Like, we all bring different skill sets and important information to the conversation. but we all need to be in that conversation. That includes nurses, it includes physicians, and it includes our other healthcare provider colleagues as well. I don't want to leave out pharmacy and respiratory and so forth. We all have different areas of knowledge, and the public needs to hear all of those things when appropriate.
Yeah, and I think that that's something that unfortunately it takes a pandemic to sort of bring this network to the surface,
Right.
that we see how many people are involved.
Yep.
So I want to give some people some food for thought to think about. Are there any particular innovative ideas or practices that you see emerging during the pandemic that you think could have a transformative effect on medicine in the long term?
So it's a good question. I mean, there were a ton of great ideas at the hackathon that I'm hoping will transform healthcare for the future. I know that a number of my colleagues, I don't work clinically, I don't work in a hospital. I'm solely innovation and education at the university, but I know a bunch of my colleagues who have been working clinically and innovating solutions during COVID-19 that they've already said, this is something that will potentially stay on well past COVID. There's a lot of stuff being done around proning critical care patients, around preventing pressure injury.
And just to clarify, proning is placing a patient on their side, or
yeah, well, on their
go ahead.
So I'm not clinical. So on their backside or on their fronts, I believe.
On their fronts. Okay. Yes.
So yeah, on their front, and then so proning, which you don't usually do in a critical care setting. Usually patients are on their backs because generally they're intubated, or it's for whatever reason, that's just normally patients are on their backs. But there's been a lot of work being done for COVID-19, especially about proning critical care patients. And then other things around proper lab handling and blood transfers, things that are coming up as really critical during COVID-19, but will be things that will need to stay on after COVID-19 as well. One of my colleagues was just talking about, they did a design thinking workshop around remote pain management during quarantine, which you could see could translate after quarantine for COVID, but for patients who are homebound, how do you do remote pain management? So there's definitely things that are being innovated and solutions that are being brought up today because of COVID that will stick well after COVID.
Marion, thank you so much for sharing this really cool work that you're doing in bringing together all of these different people from all over the world in different fields. That's really, I think, giving us some promising directions, both right now as well as for the future. We really appreciate you joining us today, and we're always looking forward to more opportunities to work with you in the future.
Well, thank you. And I just want to say that, all this work is being done by just teams of really amazing, dedicated nurses and other providers. And I'm honored to work with them. And thank you for all that you're doing to get this information out also.
Thank you, everybody, for joining us today. We'll be back with another conversation next week, so hope to see you again. Bye.